Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today our topic is related to general surgery, surgical site infection. Before going to explanation, if you want to watch the same lecture in Urdu Hindi, I already upload the same lecture in Urdu Hindi on my YouTube channel. Go and watch that video. But if you want to watch in English language, then this video is for you. Now today our topic is surgical site infections. In surgical site infection, our today topic outline is definition, etiology, clinical features, investigation, management. We study one by one. First start from definition. What is surgical site infection? How we define the surgical site infection? The definition of surgical site infection is very simple. In surgical site infection, four types of infection are involved. Number one, superficial site infection such as skin infection. Number two, deep site infection such as fascia and muscle infection. And the third is organ infection such as bone infection. And the fourth is space infection such as abscess. Surgical site infection include superficial site infection such as skin infection and subcutaneous tissue infection, and deep site infection such as fascia and muscle infection, and organ infection such as bone infection, and space infections such as abscess. This is the simple definition of surgical site infection. Now come to the etiology. In etiology, for etiology of surgical site infection, bacteria is responsible, and there are two groups of bacteria which is responsible for surgical site infection. Is number one Staphylococcus and number two Streptococcus. And in Staphylococcus, the two major groups are responsible. Number one is Staphylococcus aureus, in which methionine resistance Staphylococcus also involved. Second, in Staphylococcus aureus is Staphylococcus epidermidis. Epidermidis means related to skin. Its name show it's related to skin, like superficial site infection, skin. Staphylococcus epidermidis. And the third is Streptococcus. We broadly say the etiology of surgical site infection. For etiology of surgical site infection, the two major groups of bacteria is involved. Number one is Staphylococcus, number two is Streptococcus. In Staphylococcus, then again the two groups are responsible. Number one is Staphylococcus aureus, number two is Staphylococcus epidermidis. And in Staphylococcus aureus, the methionine resistant Staphylococcus aureus also involved. This is the etiology of surgical site infection. Now come to the clinical features. In clinical features of surgical site infection, the four clinical features are present. Number one, cellulitis. The first clinical feature of surgical site infection is cellulitis. Cellulitis means the area become red, warm, and there will be tenderness. This is the first clinical feature. Second is pyrexia. Pyrexia means low grade fever. The third is pus drain, means the first drain from surgical infection site. First drain means from surgical site. The fourth is lymph adenopathy, means lymph node swelling, but lymph adenopathy is associated with cellulitis. If cellulitis is present, means the area become red, warm, and tenderness, then there will be lymph adenopathy. These are the four clinical features. Number one, cellulitis. Number two, pyrexia. Number three, pus drain. And number four is lymph adenopathy. Now come to the investigations. In investigations, we basically do two types of investigation. Number one, blood culture for aerobic and anaerobic bacteria. Number two, pus culture. The pus which drain from surgical site, we send this pus for pus culture, and when the blood culture and the pus culture result come on the basis of this result, we give the antibiotics for bacteria, because each antibiotics is specific for each group of bacteria. Now in investigation we do aerobic and anaerobic blood culture, and number 2 pus culture. Now come to the management. When the pus culture result come and the blood culture result come, on the basis of pus culture, the bacteria who is identified in pus culture and blood culture, according to this result we prescribe the antibiotics for patient. Number 1 management is antibiotics. We know for bacteria antibiotics is the treatment, because it inhibits the cell wall activity of bacteria, it inhibits the DNA synthesis of bacteria. Now in management, the first is antibiotic, second is severely contaminated wound closed by delayed primary suture. If patient have severely contaminated wound, then this wound should be closed by delayed primary suture. Third, contaminated cavity. If patient have contaminated cavity like abdominal cavity, we place surgical drain for this contaminated cavity to drain its pus, to drain the blood, to drain the fluid. This is the management. Number 1 antibiotics, number 2 severely contaminated wound closed by delayed primary suture, and the third contaminated cavity, place surgical drain to drain the blood, to drain the pus, to drain the surgical site fluid. This is the management of surgical site infection. Now today we studied surgical site infection definition, etiology, clinical feature, investigation, management. Now today our topic is complete. If you like my video, press the like button and share these videos with your friends. If you new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon to open the all notification in order to you receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.